On your first day of chemo, you're going to be getting a lot of information spoken to you from your nurse and other parts of your care team. The good thing is you don't have to memorize it. It's all written down here for you. The binder has reference information about your drugs, about your treatment plan, about all the different mechanisms of things that are going to be happening to you during your treatment. It has a lot of information about different parts of the care team and what they do and how to contact them. But right in the front of the binder is what I call the refrigerator paper and the refrigerator magnet. You'll see a list of phone numbers. The most important one on there that I want you to take note of is the one that says My RN line. It's 443-777-6976 in case you want to put it in your phone to remember. The My RN line is sort of like your lifeline to your cancer center when you're not here on treatment. If you have side effects that you need to report that aren't being controlled by your home medications, if you have a fever or signs and symptoms of infection, which we'll go over a little bit later, then you would need to report that to the My RN line. Don't wait 3 weeks until your next chemo appointment to let us know that you have a fever. Something like that is something that we need to take care of right away. If you're feeling dehydrated, if you're feeling terrible and you don't even know why, that's the number that you want to call. The other reason that you would call the My RN line, which is where you would find the nurse navigator, is to get your prescriptions refilled. She can call in prescription refills for you to your local pharmacy so that you can pick them up without having to come into the doctor's office and get a new prescription. The only caveat to that is if you need a refill on your pain medication, especially a controlled substance, for instance, oxycodone, the nurse navigator can't call that in because that's a controlled substance. It's important that if you need a refill on your pain medication, that you give the oncology center and your doctor at least 72 hours to get that prescription ready for you. Those prescriptions have to be checked and authorized, and they need to come on a hard copy of a prescription that you can take to your pharmacy. Give us 72 hours. The best thing would be to let us know a couple of days before you're going to come in for your chemo treatment, and then you can just go up and pick it up at the desk after you're finished with your chemo. You have to physically go into the doctor's office to get that prescription refilled and then take it to your pharmacy. Some of the other numbers that are on the magnet include the administrators upstairs and the secretaries down here in the infusion center. Those are usually used if you need to change an appointment, if you don't remember when your appointment is, maybe if you need something faxed to your primary care doctor or a surgeon or some other doctor. Aside from the magnet, there's the refrigerator paper. It's right in the front of your binder, and it basically goes over all the things that you need, the basic least amount of work that you need to do to get through your chemotherapy treatment. Up at the top, again, you'll see some phone numbers. They are pretty much some of the same numbers that you have on the magnet, but there's one other one that's important, and that is the after hours, nights, and weekends number. In that case, you would call the main number to Franklin Square, 443-777-7000, and ask for the oncologist on call. It's important to do what the oncologist tells you, because if they really think that it's an emergency, they think that you need to go to the hospital, it's important to do that. We would never send a patient to the emergency room or to the hospital without a really good reason, because we don't want patients sitting in the waiting room possibly getting exposed to other infections and things. Down on the other end of that paper are just some pointers to remind you what you need to do sort of on a daily basis or a weekly basis to make sure that you are safe and taking care of yourself during your treatment. There's a lot of things in the binder that are just for your reference. Some people like to have a lot of information. Some patients come in and they just want to know the basics. So we kind of have both things for you here in the binder.